So yesterday we talked about plasma and introduction of blood. So today we will talk about blood cells. So basically, what does blood contains? Yesterday we talked that blood contains plasma and blood cells. Okay, in the plasma we have very different substance we talked yesterday. Okay, we have number of one is water, 91% is water, and in that we have globules, proteins, fibrinogen, globulins, and albumins. And in other substance, 1.5% nutrition, hormones, nitrogenous waste, respiratory gases, and electrolytes. Today we will talk about blood cells. Okay, because blood contain blood cells, then only the complete formation of blood will occur. Okay, so basically there are three types of blood cells. Okay, in our body we have three types of blood cells. One is red blood cells, one is white blood cells, and another is platelets. So these are the three types of blood cells. One is red blood cells, second is white blood cells, and third one is platelets. Okay, from where does the blood cells comes? Okay, so from where, first question is from where the blood cells will come. कहाँ से blood cells आते हैं, उनकी प्रोडक्शन कहाँ से होती है, where are they are produced. Okay, so this is very important. This is very important. The production or manufacturing place of blood cells, that is in the in the primary level. The primary level, when the child birth happens, so it is produced by red bone marrow. Okay, from the primary level, it produced by red bone marrow. Where does red bone marrow contains? It is contains in uh, irregular bones, like we have sternum here. Here is the bone sternum, right? Or hip bone or vertebral column. So they are the irregular bones where bone marrow is present. So from the bone marrow, we got blood cells. Okay. So from that, we will have different type of blood cells. Okay. Then these are the blood cells, but in the blood cells, we have different type of cells we will talk about. Okay. So here, first blood cells is red blood cells. Red blood cells also known as erythrocytes. What is the other name of? What is the other name of red blood cells? That is erythrocytes and also known as RBC. It is very important. Okay, they are biconcave in shape. Okay, biconcave in shape. So we'll see in this. So this is the red blood cells, erythrocytes. You can see. So this is the red blood cells. In that there is a red pigment color in the between. Okay, this is biconcave shape like that. Okay, but like this type of presentation is there. So RBC का दूसरा नाम क्या है? Erythrocyte. Very important. Okay, but it doesn't contain any nuclei. Okay, so हर सेल को क्या होता है? न्यूक्लिया होता है. Every cell have nucleus. So from that, where every lifespan will continue, but here doesn't have nuclei. Okay, if the cell dies, it will damage permanently. Okay, regeneration is not happening in the red blood cells. Okay, यहाँ पे क्या है? एक बार अगर सेल का डेथ हो गया, तो सेल जो है डेथ होने के बाद फिर से रीबर्थ नहीं हो सकता, ठीक है, क्योंकि न्यूक्लियस नहीं है इसके पास, न्यूक्लियस के पास डीएनए होता है, डीएनए वो मैनेज करता है पूरे सेल के फंक्शनिंग को, तो सेल फंक्शनिंग कंटिन्यू होते रहता है। ओके, सो यहाँ पे इस चीज को हम याद रखना चाहिए। अब व्हाट इज द नॉर्मल रेंज ऑफ आरबीसी, हमारे बॉडी में कितना होना चाहिए? एक अगर माइक्रोलीटर ऑफ ब्लड को लिया जाए, ओके, it अमाउंट है one, if we take one small amount of blood RBC, okay, or blood, in that blood we have how much amount of RBC does present? It is 4.5 to 6 million. In that some cases we have 6.5 also. 4.5 to 6.5 is normal range of RBC. Okay, this is the very important thing. Second thing you have to remember, so whenever a report came, pathology report came, you can see RBC in the CBP, complete blood picture. We see three things mainly. One is RBC, second one is WBC, third one is platelets. Then afterward we will see HB, hemoglobin, and other cells. Okay, so whenever pathological reports come, CBP, complete blood picture, you have to see RBC. So what is the normal range of RBC? That is nothing but 4.5 to 6.5 million per 1 millimeter of. Okay, but in the some women's it is normal, but 12.5 sorry 3.5 to 5.5 in women's. Okay, because they have monthly, okay, they have uh, monthly periods, so that is the reason. What will happen, we have less amount of blood in the women's. Basically, the normal range of blood in the woman is 3.5 to 5.5. Okay, this is the normal measure. Okay, so basically, and the third thing is the amount of red blood cells present in the body. If you compare to other blood cells, that is 38 to 48%. Okay, so these are the things we have to remember. And what are the function? Because what is the main function of RBC? RBC, red blood cell, contains a protein that is called hemoglobin. What is the name of the protein? That is hemoglobin. Hemoglobin, what does hemoglobin do? Hemoglobin will connect with oxygen. Okay, it will bind with oxygen. Okay, and it will take and it will travel to the body cells. This is the main function of आरबीसी। तो आरबीसी का फंक्शन क्या है कि आरबीसी अपने ऊपर एचबी एक प्रोटीन है। अब देखिए प्रोटीन क्या है, ये सब हम लोग जानेंगे बायोकेमिस्ट्री में। यहाँ पे इतनी बात याद रखिए कि एचबी एक प्रोटीन है। व्हाट इज एचबी? एचबी इज एक प्रोटीन, यू हैव टू रिमेंबर दैट, फर्स्ट थिंग। सेकंड थिंग इज दैट एचबी विल सिट ऑन आरबीसी, उसके ऊपर वो बैठ जाता है। अब एचबी की काम क्या है? एचबी ऑक्सीजन को बाइंड कर सकता है, जो हम सांस लेते हैं ऑक्सीजन, वो एचबी से मिल जाता है और एचबी से बाइंड होके वो आरबी से जैसा ट्रैवल करते हैं वो उसी तरह ट्रैवल करके बॉडी के सेल्स को ऑक्सीजन पहुंचाता है। दिस इज द मेन फंक्शन ऑफ आरबीसी। So each red blood cell contains approximately 300 million hemoglobin molecules, of which can bond to 4 oxygen molecules. So we have how much amount of hemoglobin molecules? They have 300 million. 300 million HB molecules are there. So on that hemoglobin, the HB, or else what do we tell? The oxygen, how much amount of oxygen will bind? 4 oxygen will bind with this RBC, this HB. Okay, so you have to remember these three things. One is the RBC connect with HB, HB connect with oxygen. If oxygen less, what will happen? Okay, what will happen? Oxygen cannot reach to the cells. If HB less, if the large amount of oxygen is there, but Hb is let Hb less means the oxygen is not able to sit on RBC. So then also the cell didn't get oxygen. Third thing you have to remember that if you have Hb levels are high, if you have oxygen levels are high, but there is less amount of RBC, what will happen? The RBC will not reach to the maximum amount of cells. What will happen? You will get decreased level of oxygen. Then the other things will happen. Okay, this is very, very important. So how the connection will happen? If you inhale the oxygen, okay, if you inhale the oxygen, what will happen? The oxygen will bind with RBC. Okay, RBC have oxygen, RBC have Hb. Oxygen and Hb connect with each other, and this will happen oxyhemoglobin. What will happen? Oxyhemoglobin. So then what will happen? The oxyhemoglobin will reach to the body cells. Okay. So if the second thing you have to remember that is what is the normal range of Hb? That is normal range of Hb is 12 to 18 grams per 100 ml of blood. So if you have 100 ml of blood, if we check the Hb, what is the maximum amount? 12, minimum amount 18, minimum 12 and maximum 18. Okay. So what is the role of Hb? You have to remember. The role of Hb is the formation of mineral that is called iron. We are going on deeply. RBC contains Hb. Now Hb contains iron mineral. So each Hb contains 4 atoms of iron. 4 atoms of iron metal. So if the maximum amount of iron is present in the Hb, then the maximum amount of oxygen will bind with Hb. This is very, very important. You have to remember. So we need RBC, we need Hb, we need iron also for normal functioning of the cell. Second thing. First thing is you have to remember completely. Second thing is that Hb not only transport oxygen, it also transport carbon dioxide from the tissue to the lungs. Okay. This is very, very important. You have to remember. But not 100% carbon dioxide is transported by hemoglobin. Only 10 to 20% of oxygen is carbon dioxide is carried or thrown away from the body through systemic circulation from the lungs. But mostly the 80 to 90% carbon dioxide is transported with bicarbonate ions. Okay, this is the thing we have to remember. Next is production. I told you that where does production happens. Till now, what we talked about, the blood cells. The blood cells are RBC, WBC, and platelets. What is the name of RBC? Another name is erythrocytes. Erythrocytes. Erythro means red, cytes means cells. Erythrocytes means red blood cells. These are the things you have to remember. And second thing is what is the normal range of RBC? That is 4.5 to 6.5. Okay. And the third thing you have to remember function. What is the function? The RBC contains hemoglobin. Hemoglobin contains iron. We have in each RBC you have 300 million molecules of hemoglobin. For that, 4 molecules of oxygen is binded. Okay, this is the first thing. And second thing you have to remember that hemoglobin contains iron minerals also. Iron minerals also. So iron will bind with hemoglobin. So each Hb molecule contains 4 iron minerals. Okay, so this is the thing you have to remember. And another thing you have to remember is what is the normal range of Hb? Hb contains in 100 ml, that is 12 grams to 16 grams. Okay, so we need to remember these are the all things which is very, very important. And the third thing you have to remember that the carbon dioxide also excreted from the help of Hb, but 10 to 20%. But other 80 to 90% is remain and it is excreted with the help of bicarbonates. Okay, what is the how it produce and maturation? Maturation, where it happened? Basically, I told you that in the body we have red bone marrow. Red bone marrow is present in the irregular bones. Okay, irregular bones produce red blood cells and other blood cells because it have precursors. What is meant by precursor? Precursors or stem cells. Okay, they are unspecialized cells. Okay, they may develop a number of cells. Okay, from that cells we will produce number of cells. So basically क्या है ये precursors? एक सेल है भाई. ये सेल क्या करेगा? ऐसे सेल को प्रोड्यूस करेगा वो आगे चल के डिफरेंट सेल्स को प्रोड्यूस करने वाला है. ठीक है, तो उसको क्या कहेंगे? स्टेम सेल्स. यानी स्टेम सेल्स दिस इज नथिंग बट एक रूट है. वो रूट से अब आपको डिफरेंट आपको सेल्स मिलेंगे. मगर यहाँ पे क्योंकि ये ब्लड सेल्स को प्रोडक्शन करने वाला स्टेम सेल्स है, इसलिए यहाँ पे सिर्फ ब्लड सेल्स ही प्रोड्यूस होंगे. दिस थिंग यू हैव टू रिमेंबर. ओके, the stem cells of the red bone marrow also called hemocytoblast. दूसरा नाम क्या है? Other name of stem cell, that is hemocytoblast. Hemo means blood, cyto means cells, blood means production. Blood cell production in house. Hemocytoblast. Hemocytoblast is the area where blood cell production happens. So where is that area? Red bone marrow. Red bone marrow is that area. Okay. सो वहां पे डिफरेंट काइंड्स ऑफ सेल्स बनते ही रहते हैं. प्रोडक्शन है, कंपनी है, बार बार सेल्स बनते ही रहते हैं. फिर आगे चल के आरबीसी, डब्ल्यूबीसी और प्लेटलेट्स में कन्वर्ट होते हैं. सो व्हाट विल हैपन इन इलेक्ट्रोहोम्योपैथी? द रेड बोन मैरो इज वेरी वेरी इंपॉर्टेंट बिकॉज इट इज द फैक्ट्री ऑफ प्रोडक्शन ऑफ blood cells. Okay, so in the pulse diagnosis we'll talk about a red bone marrow also. So the pulse diagnosis belongs to electrohomeopathy, not acupuncture or not Ayurveda. Okay. So this is different from Ayurveda, acupuncture. Okay. So in the coming classes in electrohomeopathy or organ of electrohomeopathy or Maitreya Medica, we will talk about pulse diagnosis. Okay. And the other type of diagnosis which are helpful in the electrohomeopathy to diagnose the disease. So in that, for who have, can you guess? In the electrohomeopathy, we have three types of temperament. Okay, nowadays there are five types of temperament. We can assume that, but basics is three temperaments. One is sanguine, another one is lymphatic, and another one is mixed. So sanguines mean blood temperament. Okay, and lymphatic means lymph temperament. Belong the person nature is lymphatic. Persons will have the in future he will have the lymphatic temperamental diseases, but in the sanguine he in future he have blood temperamental diseases and blood related his genre. Okay, so here in the sanguine temperament, a red bone marrow will have very important what we can tell, very important combination, very important contribution. Okay, for the sanguine temperament. Okay, here the red blood cells, WBC platelets are active. He have very number of blood cells. His blood cells are very rapidly improve. Okay, he will have in future diseases like hypertension, piles, bleeding piles, any blood disorders. Okay, because his red blood cells are very active. Oh, sorry, red bone marrow is very active. Okay, so what will happen if there is less amount of blood cells in the body, what will happen? We have hypoxia. Hypoxia means, hypo means less amount of, less oxygen means less amount of oxygen. What will happen? This type of disease will occur. And the main important thing you have to remember that in the red blood cells can't start making themselves the blood cells. अब यहाँ पे रेड ब्लड सेल्स जो है ना, वो खुद अपने तरफ से ही ब्लड सेल्स को नहीं बना सकती। उसके लिए एक इंडिकेशन की जरूरत है, उसके लिए एक मैनेजर की जरूरत है, उसके लिए एक स्टिमुलेट करने वाले एजेंट की जरूरत है। द स्टिमुलेशन एजेंट इज नथिंग बट एरिथ्रोपोएटिन। इट इज वेरी वेरी इंपॉर्टेंट। एरिथ्रोपोएटिन is produced by kidneys. Who produce erythropoietin? Kidneys produce erythropoietin. Okay, this is very very important. We have to remember that. Hmm? So here we have the cycle of stem cells. I will explain you. This is the cycle of red blood cells. Red blood cells. This is the, yeah. So this is the diagram of, huh? Red cells. You can see that this is the stem cell. From the stem cells, we have different types of cells. We have normoblast, we have basophil, we have gland cell, we have eosinophil, okay. We have monocyte, we have lymphoblast. Okay. From the monocyte, we have macrophage. From the lymphoblast, we have T cell, plasma cell, B cell. Okay. From the band cell, we have neutrophil. From the normoblast, we have reticulocyte. From the reticulocytes, we have erythrocytes. So, first of all, you have to draw the diagram of this image. Then only you will able to understand. So we have different types of cells. The different cells of cells produce different types of cells. So basically, the two things, another two things we have to remember. But these are the blood cells. Blood cells after maturation, they will work. But what other factors? What are the other things? They will improve the maturation process of the red blood cells. We need two things. One is folic acid and vitamin B12. Okay. So it is the very important, two important nutritions. Okay. Two important nutritions. Very two important nutritions. Okay. Which is synthesize the function of red blood cells. This is the first thing. And second thing, that is in the stomach. In the stomach, we have the chemical that combines with vitamin B12 in food to prevent its digestion, promotes its absorption in the small intestine. So you need three things. One is folic acid, vitamin B12, and third is the cells which will absorb B12 and which will digest B12. So if there is deficiency of B12, if there is deficiency of folic acid, what will happen? There is the chances of anemia. There is the chances of anemia. So these are the things you have to remember. So what is the lifespan? The lifespan of RBC is 120 days. After 120 days, they will become old, fragile, and very, very dull. So the oxygen will can't bind with it. Okay, oxygen can't bind with it, and oxygen cannot uh, reach to them and bind with that. So basically, it is very useless. So after 120 days, what will happen? We have one organ that is nothing but spleen. Spleen is the uh, what we can tell that it is the area that all the RBCs will damp. Okay, RBCs are damp in that area. Okay, this is a thing very, very important you have to remember. So other than that, we will discuss tomorrow from here. Okay. So the most important things I will discuss today is RBC. The RBC need, what is the maximum amount of RBC? 4.5 to 6.5. And second thing is the name of RBC is erythropoiesis. And we have 38 to 40% of RBC in the blood cells. And what is the function? It carries oxygen and it will reach the oxygen to the cells. Okay, RBC have HB connected with oxygen, and HB have iron also, iron metal. In each HB we have four iron metals. These are the things we have to remember. And again, HB also normal. The normal range of HB is 12 to 16. Other than uh, other than that, other than that, the hemoglobin, other than hemoglobin, we have RBC not only bind with oxygen, it also binds with carbon dioxide, but only 10 to 20%. Other carbon dioxide is released from the body with the help of bicarbonate.
Sir,
Okay. And where
fine, yeah. Yeah, special.
fluctuation will happen. Okay. Will happen. It is in bone marrow. Okay. These are the things very, very important. And another thing is you have to remember that is folic acid and vitamin B12 is very, very important for the maturation of RBC. Other than that, from the stomach, we have we have cells which will help for the absorption and digestion of vitamin B12. If vitamin B12 or folic acid is decreased, what will happen? We have pernicious anemia. From lifespan, we will talk about, we will talk from tomorrow. Okay, and I will continue the lecture. Pernicious anemia. If anyone have, you can ask.